Hi, I'm Stefan Kertesz. I'm a researcher and a doctor from the CSI opioid study. A recent report from the U.S. Department of Veterans Affairs found that 54% of veterans who had taken their own lives had pain. It got attention from some key publications like Stars and Stripes and Pain News Network. But what did the data mean? Do these findings mean that pain causes suicide? What could health systems do better? How can we help? My name, as I said, is Stefan Kertesz. I'm a doctor in internal medicine. I do specifically suicide research, the only study in the US that's trying to get the in depth story of pain related suicides. It's called CSI Opioids. And anytime you want to learn more about the study, you can go to csiopioids.org and check it out. I want to use this video to explain what we know about suicide risk and pain, and I want to get to that new VA report. But first off, a couple of careful cautionary points are absolutely essential. One is that there's a lot of appropriate caution and sensitivity for anyone who wants to discuss suicide in public. The reason for that is that we can risk making suicide seem inevitable, or even, if we do this wrong, making it seem desirable. Why is that? Well, it goes back to a book published 250 years ago in 1774, Sorrows of Young Werther, and it described a tragic love triangle. And it led to a spate of suicides in Europe. They were called copycat suicides, and it was actually, the book was banned in Denmark and in the city of Leipzig and in Italy for that very reason. Now that's 250 years ago. How about now? A systematic review was published in 2020 in BMJ, looking at 20 studies. And there's a 13% increase in suicides after a celebrity death, but not after a regularly non-celebrity suicide. We don't want to encourage that. I don't want to encourage that. So let me remind folks, suicide's rarely caused by one single risk factor. And although a large number of people sometimes feel like they might wish to die, they don't usually act on it or they don't usually complete it. Now, if you are in crisis, consider reaching out for help. That could be someone who's local to you. It could be a friend. It could be national. It could be dialing 988 or checking out 988 Lifeline. The second thing I want to say about this video is I'm speaking for myself. I'm an employee and a doctor within the Veterans Administration. I'm also a professor at the University of Alabama at Birmingham. I run this research study, but when I speak here, I'm not speaking for the VA. I'm a researcher. I speak from what my research tell me as a professor and also from what I see in the clinic. Now, if you want the opinion of the VA on their new report, please contact the VA press office. So we're going to get to that report in a moment, but it's important to talk about pain as one of many risk factors for suicide. So, is pain a risk factor for suicide? Yes, absolutely. A review of the world's literature was published in 2018 by a scholar named Melanie Racine, Racine. 1 out of 5 people in the world has chronic pain, so this is a big deal. And what Racine reported across many studies is that if you compare folks without pain to folks with pain, the risk of suicide is higher in the people with pain. For death wish, suicidal ideation, suicide attempt, even completing suicide, there's a relative increase in all of those things for the people with pain, a multiple of about 2.5 to 3.5. Okay, right off the bat, that sounds pretty bad. But this is where talking about risk multipliers and risk factors gets really tricky, because if something increases risk by a multiple of 2 to 3, it's serious. But if the rate of people doing that thing is still pretty rare, then the multiple doesn't mean that all people with pain are going to die by suicide or even consider it. Now, there are other risk factors for suicide, weaker ones and stronger ones. Diabetes, the risk multiplier is 1.6. Access to a firearm, 3. Mood disorder, 12. A prior attempt of suicide, the multiplier is 16. In fact, with a rare event like suicide, even people with a whole bunch of risk factors don't necessarily do it. And if you make a model to try to predict who's going to die by suicide and you choose out the top 5% at risk, combining all those factors, most of the people in that top 5% aren't going to try to die by suicide. And many of the suicides are going to occur in people in the bottom 95%. But still, pain stands out a lot. It's really common. 20% of the people in the world have chronic pain. 16 to 30% of people with chronic pain at least passively think about dying by suicide. And pain leads to healthcare encounters where we could have an opportunity to prevent it if the clinicians or the pharmacists thought about it, when in fact they usually don't. That brings us back to the VA report. Every year, usually, the U.S. Department of Veterans Affairs issues an omnibus report on suicide, and it's jam-packed with statistics, and it's a professional and solid report. And I encourage you to check it out. Just Google VA Suicide Prevention Report 2024. And in every version that I've seen, the main results are on statistics. Are there really 22 veteran suicides a day? Are the rates going up or down? Are the folks who die by suicide in VA healthcare? And it turns out the answers aren't always the same as you'd think. 17.2 veteran suicides a day occurred in 2022. 40% of those had no contact with VA healthcare or benefits, but 40% actually had a VA healthcare encounter in the year before they died. It means a lot of veterans die without having seen the Veterans Health Administration. Maybe we could have helped. Are the suicide rates for veterans rising? Yeah, if you do the analysis correctly and compute for how many people are at risk, there's been a rise in suicide from 2001 to 2022 across the US population at large and also across veterans. And it's for men and it's also for women, and it rose more for veterans than for non veterans. Now, you got to do a lot of statistical adjustments to get that result, but that's the major focus of this report. The rates of suicide are also usually higher in people with mental illness or people who are diagnosed with addiction or post traumatic stress disorder or psychotic illnesses. Finally, there's the thing that caught the news' attention, and I'm appreciative that it did, actually. Near the back, there's a piece I haven't always seen, and it comes from a separate team called the Veterans Administration Behavioral Health Autopsy Team. When there's a suicide of someone in VA care, a professional tries to get records such as they can from the medical chart or by talking to law enforcement, whatever they can get. It's not an omnibus interview, but they get what they can. And they looked at 2,654 veterans' suicides that they were reviewable. There are limitations. For example, if someone died and had one VA visit for a vaccine, but normally saw a doctor for pain through their Blue Cross Blue Shield plan, the VA is not going to know about the pain. And the report itself says to be really cautious when you interpret that. A lot of these risk factors might be more common rather than less so, according to the numbers in the report. But pain in the year prior to death, 54% of the people who died by suicide had that. Sleep problems, 51%. Relationship problems, 33%. Financial losses, 24%. Hopelessness, 30%. Unsecured firearms, 27%. Now remember what I said. These percentages are based only on what they can find in a medical chart or by talking to somebody. But this table really hit home, and that's why it caught the attention of Stars and Stripes and Pain News Network, and frankly, I wish it caught more attention. Why? Because suddenly this information puts the relationship between pain and suicide on the table. And most major news outlets just ignore this. In fact, most reporting on pain has taken it as the only problem with reporting is how we need to reduce the number of prescribed opioids. And I assure you that has happened. The rate today is down to the levels last seen in 1992 on a per capita basis. But nonetheless, we shouldn't be ignoring pain as a problem that really affects people profoundly. Now, remember, I'm not speaking for VA when I say this, but I have developed a real concern that the health system at large, all across the country, has focused on reducing opioids in ways that were frankly dangerous or unsafe. And actually, it was a VA analysis team led by some folks in Palo Alto that began to show that that risk was real and published a paper in BMJ in 2018. Does this mean that we should give opioids just to prevent suicide? No, not exactly. But it means we need to really be thoughtful, and health systems need to be thoughtful. And a lot of agencies and quality metrics and insurers have not been thoughtful. I'm going to quote a patient with pain named Anne Fuqua. Chronic pain is known to be both common amongst people who die by suicide and a frequent issue identified as a reason for ending one's life. If VA claims that preventing suicide is a top clinical priority, then when chronic pain is present, they should treat it aggressively, employing whatever medications and interventions are needed to best treat an individual without being handicapped by artificial limits that have no relationship to the individual veteran's clinical situation. I agree with her, and I think it applies to non-veterans as well as veterans. And what I would say is we need to ask very carefully, very specifically, and very systematically what's going on in the lives of folks who are in distress. And frankly, what's overwhelmed me in this suicide story is the total lack of curiosity or interest or concern in many folks I've spoken to, from health institutions who do opioid scholarship or run insurance benefits programs. They don't see suicide as a thing that they should be trying to prevent. I think getting the story here could help tip the balance for this discussion, but we need to do research. We need to do it rigorously and not just to drive it to one particular end. I run the only major study trying to get the actual story of what happened in these deaths. It's called CSI Opioids. And I came to this study because I came to think that statistics alone will never tell us exactly what we need to do to help people. We need to learn what the heck happened in the life of a person who died, and then we need to make recommendations. If you're interested in this subject, I really urge you to check us out. Our general information website is csiopioids.org. If you'd like to be considered for eligibility in the study, there's actually a paid interview. The information we collect is incredibly secure. There's informed consent. There's a payment for the interview of about $100, but you can check that out at https, okay, you all know that, go.uab.edu slash CSI opioids. That's go.uab.edu slash CSI opioids. Additionally, if you are generally interested in understanding suicide in our society at large, I like the website for the American Foundation for Suicide Prevention, or afsp.org. If you are dealing with crisis right now, consider reaching out to the 988 Lifeline. They have a website at 988lifeline.org, and in any community in America, you can dial 988 and seek help. And finally, if you're from a military family that has suffered a loss, consider Tragedy Assistance Program for Survivors, or TAPS. That's an excellent major national organization. Again, it's appropriate that some news media outlets paid attention to this finding about pain and suicide. It doesn't mean that every person with pain is going to be considering suicide or die by suicide, but we need to take this story really seriously, and I would love to hear back from you. Thanks a lot for your attention.